Right. Hello, good morning and good afternoon, wherever you may be. Welcome to another edition of our It's Worth a Shot. We're happy that you were able to join us today on September 25th, nearing the end of the month. And of course, you may already be aware that September is Sepsis Awareness Month. So today we have our very own Ray Tepling from Mountain Pacific. He is our king data scientist, and he's got all kinds of great information and data that he's going to be sharing with you in today's session. Mary, next slide, please. So just some updates or observances. Of course, September not only is National Sepsis Awareness, but it's also National Preparedness Month. It's an observance to raise awareness about the importance of preparing for disasters and emergencies that could happen at any time. This year's theme is disability inclusion and accessibility. This link that we have here will take you to the CDC's website and offers a plethora of tools, resources, objectives, and guides. And then, of course, on October 13 to 19, we have our Infection Prevention Week. Our infection preventionists play a crucial role in keeping the public safe and healthy, protecting us from surges in healthcare-associated infections and many other infectious threats. So honor our infection preventionists and all the staff that help in this endeavor in keeping our residents healthy and safe, and to shine a light on our infection preventionists each and every year. So enjoy your Infection Prevention Week. Next slide, please. And of course, the National Healthcare Safety Network, NHSN, they had a conference or webinar yesterday. And so beginning September 30th, individuals are going to be considered up to date if they've received the new single dose of the 2024-25 COVID-19 vaccine. So under the new recommendations, most of individuals will not be up to date until they have received this new vaccine. Facilities will need to report 0 until the individuals actually receive that vaccine. Next slide, please. So here is just I mentioned yesterday, NHSN had their initial webinar. They have a replay coming up October 1 and October 9. So if you missed the September 24th one, register in advance, listen to those replays. It had a really good information on the new updates to the NHSN. Next slide, please. And then additional webinars that they are hosting. There is a person-level vaccination forum, Q4 update for long-term care facilities. And those are dates listed there on your slide, October 2nd and October 16th. And you'll want to register in advance so you have access to those. Next slide, please. And as always, we love to hear from you in the evaluation link that Mary will put into the slide deck later. We always love to hear what topics, clinician ideas that you would like us to share in upcoming It's Worth a Shots. We will continue to meet every Wednesday, so we would love to hear what other topics you would like that's important to you and your community. Next slide, please. Just some influenza snapshot. As you see, most of the United States is in that green. There is a little uptick there in the state of Alaska, but that's just the beginning of our influenza respiratory virus season. Next slide, please. And here's our weekly COVID snapshot. And as you see, again, they're all pretty much in that green area, but it is the beginning of respiratory virus season. And I believe we have a polling question. So Mary, if you could kind of get that off for us. All right. As respiratory season approaches, what are your strategies to protect residents against respiratory viruses? Select just one option. What is going to be your primary focus? Will it be increasing vaccination efforts for both influenza and COVID-19? Will it be requiring surgical masks for all staff and visitors? Will it be improving air filtration systems or providing additional training for staff on infection control practices. We'll take a few minutes. Looks like we have 49 participants in our call today, and we're about 50%. So we'll give a few more minutes. Love to hear your answers or see your answers. All right. How about a few more? We're at 30. Can we get this to 35 people? All right, very good. Okay, Mary, if you want to go ahead and end that poll. It looks like here we share 77% of you have indicated that we're going to be focusing on vaccination efforts in influenza and the COVID-19. All right, very good. We can go ahead and end that, Mary. And next slide, please. All right. So I want to turn the microphone over to our famous Ray Tupling, who is the king of data science. And so he has some information to share with us on our Sepsis Awareness Month. It's sepsis in our region and what those numbers look like. Ray, take it over.
All right. Well, thank you for that introduction, Jolene. And for the record, I'm not nearly that important, but the data is. So that being said, today I'm going to be talking about sepsis, its prevalence throughout the region, and some of the financial impacts that we see associated with it. So next slide, please. So we'll give my little preamble about where this data is coming from and how we put it together. So we're primarily looking at Medicare claims, inpatient claims from Part A, and also some beneficiary information, demographics, nursing home resident stay information, et cetera. We're going to break it apart into 5 calendar years from January 1st, 2019 to December 31st, 2023. And we're looking at Medicare fee-for-service beneficiaries in the following states: Montana, Wyoming, Alaska, Hawaii, and the Pacific Islands. And I'll preface that by saying whenever I say Hawaii going forward, that does include the Pacific Islands. And finally, if time allows, we're going to take a look at some publicly available information from CMS, referred to as the National Health Expenditure Data Set. We're specifically going to be looking at some per capita spending levels by a couple of different categories. If we happen to run out of time, I've included the URL of where this data lives. There's a ton of information in there, and frankly, it could be its own presentation. But that being said, let's dive into our population a bit more. Next slide, please. So as the states I previously mentioned, you can see they're all right here. We've got our general population there on the left and counts of Medicare fee-for-service bennies on the right. Now, you don't have to memorize any of these numbers. It just gives us a sense of what the population is we're dealing with. Now, these are relatively small population numbers in terms of both general population and fee-for-service Medicare bennies, but they cover an extremely wide geographic area, going from Wyoming to Guam, or Alaska down to Montana. It's a very wide geographic area. But that being said, throughout our region, we see about almost 3.9 million people, of which about 588,000 are Medicare fee-for-service beneficiaries. Now, of course, that number is going to ebb and flow as people die off and as people age into Medicare. But for the purposes of this presentation, about 588,000. So next slide, please. We'll actually get into our topic of the day, sepsis. So what we're looking at here is just the frequency of sepsis claims among our fee-for-service population. Now on this chart, we've got year on the x-axis going from 2019 to 2023. On our y-axis, we've just got count of beneficiaries with a sepsis claim, and that's broken apart by each state represents a different color. Now, throughout our region, we see a range of about 9,000 to 10,000 sepsis claims every year. And unfortunately, it's very consistent. There doesn't seem to be any major breakthroughs in how we treat and prevent sepsis, unfortunately. On the right, we've got a table that just gives us the average annual number of sepsis claims that we see in each state. Again, throughout our region, there's about 9,300 sepsis claims every year. And then you can pick out your state of choice. Wyoming, for example, has about 1,500 sepsis claims every year. Now, on the next slide, we're going to take these very same claims we're looking at right now, and we're going to look at the overall Medicare payments associated with those very claims. And unfortunately, the numbers get much, much larger. So at the state level, we see extremely high values. Alaska, for example, is nearly $59 million per year on average for sepsis claims. Region-wide, it's a little over $260 million for sepsis. Now, I'll note that we looked for sepsis claims using ICD codes. We looked for ICD codes related to sepsis in any position on the claim. The overwhelming majority came back with sepsis as the primary diagnosis. So I'll admit, yes, we cast a wide net to find sepsis claims, but that being said, we probably didn't have to cast that wide. So that being said, let's dive a little bit deeper into the financial impact, and we're going to get a little bit more acute in terms of how sepsis affects each and every beneficiary out there. So, oops, sorry, back one slide, please. So we're going to focus in on calendar year 2023. So we're looking at, on the left there's a number of claims in calendar year 2023. In the middle, there's the Medicare payments in 2023 for those very same claims. And we'll work our way over to that cost per infection number. Now, for this example, let's walk through Alaska. In 2023, there were 2,197 sepsis-related claims. For those 2,197 claims, there were a little over $65 million paid out by Medicare. So if we take our $65 million number, divide it by the 2,197, that gets us to an average cost per average cost per infection of $29,670. So in Alaska, on average, that sepsis infection is going to cost Medicare nearly $30,000. Throughout our states, we see a range of about $25,000 to $30,000 paid out for each sepsis-related claim. And really the takeaway here is, if you're an infection preventionist, if you're a hospital administrator, if you're anybody advocating for infection prevention resources, this is a fantastic number to have in the back of your pocket. If you can say, if we avoid a single sepsis infection, it's going to save Medicare anywhere between $25,000 and $30,000. All of a sudden, infection prevention training looks pretty affordable. Now, unfortunately, there's not a direct financial incentive. We'll talk about that a little bit later. But there's an indirect financial incentive, is that this is public money being paid out. We're all taxpayers. These are our hard-earned tax dollars at work. So let's go to the next slide. And we're going to focus in on our nursing home population. So again, we're looking at sepsis claim frequency. This is going to be specific now to nursing home residents who are fee-for-service Medicare bennies. And again, we see some unfortunate consistency and maybe even an upward trend here in the data, where in 2019, we had just under 600 sepsis-related claims among our nursing home residents throughout the region. And that increased in 2023 to a little over 700. On average, every year throughout our region, we see about 679 sepsis claims among our nursing home residents. And again, you can pick out your state on that table on the right. Montana, for example, sees about 276 sepsis claims among their nursing home residents every year. So again, let's take these very same claims. Let's look at payments associated with them. So next slide, please. And so throughout the region, we see a little over $16 million paid out every year just for our nursing home beneficiaries who have a sepsis-related claim. Unfortunately, the consistency is still there. So let's dive a little bit deeper. I know I'm trying to watch the clock here, so apologies for if I'm going too fast, but let's go to the next slide and we'll look at our cost per infection for our nursing home bennies. So again, we're looking at 2023. Let's walk through Hawaii in this example. So in 2023, beneficiaries in Hawaii had 222 sepsis-related claims. Payments associated with those in 2023 were just over $6 million. And so if we take our $6 million divided by 222, that gets us to the $27,875 in terms of cost per infection. Now, we see slightly lower values in terms of cost per infection among our nursing home residents. Generally speaking, sepsis is caught a little bit sooner among our nursing home residents because, as you think about it, they've got people checking on them every day who know what to look for in terms of sepsis. So generally speaking, not always, these sepsis cases among nursing home residents are caught a little bit sooner. So that's why we see a little bit lower value. But that being said, we still see a cost per infection range between $22,000 to nearly $28,000. So again, if you're advocating for sepsis or any sort of infection prevention resources, fantastic number to have in the back of your pocket. So I think we're okay on time. I'll talk briefly about cost of care. So we'll go to the next slide, and we're going to look at a data set that, like I said, CMS refers to as the National Health Expenditure Data. I've included the URL on all of these slides, so if this piques your interest in any way, it should be readily available data. So everyone's heard anecdotal evidence on the rising cost of care. Well, today we're going to actually tie some numbers to it and see what those growth rates actually are for cost of care. So the category we're looking at right now is called personal health care. CMS statisticians refer to this category as the overall bundle of healthcare goods that a person consumes. So that's going to include inpatient care, outpatient care, prescriptions, durable medical equipment, dental services, everything that you could possibly consume in the healthcare space. So what we're looking at here is our spending per capita, so per person, what's spent every year, and it's broken out by state. I'll draw your attention to that blue line. That is the United States in average, so that's our national average. What we see across the entirety of the US is a growth rate of 4.7%. So every year we can assume our personal healthcare spending is going to grow by a little over 4.5%. You'll see that red line, that's Alaska at the very top, and we're going to dive in 2 slides to look at why we see a huge gap between Alaska and the rest of our states. So next slide, please, and we'll break apart this personal healthcare spending category a little bit more acutely. So this category is called hospital care. It's our proxy for inpatient care. We see that Alaska and Wyoming, the red and pink lines, are at the very top. So more is spent per person in those states on inpatient care, followed by Montana, that green line, and then that blue line indicating the US in aggregate. And again, we see about a 4.5% growth rate throughout the US on this over this time period. And so next slide, we'll dive into our outpatient category, referred to as physician and clinical services by CMS statisticians. This is really the big driving factor of why cost per person is so much higher in Alaska. It really comes down to their costs of outpatient care. You'll see, obviously, that red line is way at the top. All of our other states are generally clustered right down there at the bottom. And you'll notice that the Alaska line is a bit steeper. So not only are costs higher in Alaska, they're increasing at a faster rate. But the US in average sees an average annual growth rate of about nearly 4.5%. And then finally, the last slide, next one, look at pulling out just dental services. I just thought this was an interesting one. Again, we see Alaska at the top, and for dental services, we still see a growth rate above 4% across the US. Interestingly enough, Hawaii is down there at the bottom, that sort of split pea soup green color line. And really what that tells me is Hawaii is the most efficient at providing dental services per person. And so obviously that assumes that dental services are the same state to state. One could argue that's not always true. But that being said, we see lower spending per person in Hawaii. So with that, I hope you at least learned some fun facts about the increase in cost of care, and we actually have some numbers around how quickly healthcare costs are increasing. Now, the big question is what's being done about it? What's being done to address the financial impact of sepsis and cost of care? And we'll go to the next slide. And this is why I think we're seeing some alternatives to this fee-for-service payment model under the guises of value-based care, primarily driven by accountable care organizations, and the total cost of care model. Both of these, I would say, are still in their infancy, especially total cost of care. I think it just came up on its first year of being implemented. Neither of these, I would say, are perfect, but I think they are a step in the right direction. And just that bold text there at the bottom, that's the reason why. They align financial incentives with prevention rather than treatment. And I think it's an exciting time to be in healthcare. Hopefully these alternatives to the fee-for-service payment model do address some of the issues that we're seeing. So that being said, that concludes my presentation. If there's any questions, feel free to put them in chat or come off mute. If not, I'll hand it back to you, Jolene.
All right, very good. Thank you, Ray. So let's open it up. Do you have any questions for him on the data and information that he shared? Can come off mute or drop something in the chat. And then just as a reminder, Mary has put a link in the chat for our evaluation. So please take a quick moment to open that up to take 10 seconds and complete that evaluation for us. All right. So nothing in the chat. Oh, Chad, thank you. He says, excellent, Ray, thank you. Good information shared. All right. Okay. Thank you, Ray. Appreciate your time today. Mary, can we go to the next slide? Here, I want to just take a few moments. I want to share some insights from a case study that involved an urban 92-bed skilled nursing facility in our region. They use an EMR system with an SBAR assessment tool. Our goal was to understand why their residents were being hospitalized with sepsis and to prevent infections that led to these admissions. So we had implemented several key tools like the sepsis zone tools for early detection and prevention, and also the sepsis badge buddies. They were distributed to all the staff members, including environmental services, dietary, and nursing. Through a comprehensive root cause analysis, we identified two primary factors that are contributing to the hospitalizations. One was aspiration pneumonia. This was largely due to inadequate nurse training on proper suctioning techniques and the premature repositioning of residents after meals. As a result, the residents lying flat increased their risk of aspiration pneumonia. The second root cause was improper oral hygiene. There were challenges in delivering appropriate oral care, particularly for residents with dementia and dysphagia. So to address these issues, the following steps were implemented. We looked at standardized protocols. The facility with Mount Pacific established clear protocols for early sepsis detection and integrated the latest guidelines into the tools, such as the sepsis zone tools and the badge buddies, and also when to stay or go hospital tear pads. Protocols for oral hygiene were also refined, focusing on residents with dementia and dysphagia. Then there was training and education. The SBAR tools were reintroduced to the licensed staff, emphasizing their use and proper EMR documentation. A 1-hour hands-on training was conducted to the CNAs in partnership with a local dental service foundation and hygienist. This included practical demonstrations on how to perform oral care effectively, especially for those residents with dementia. Tools like bite blocks were introduced, and residents and their families were involved in this training as well. Lastly, the residents and their families were educated on sepsis signs and symptoms. There was monitoring and evaluation. So after the training and education were completed, the facility conducted daily spot checks and audits to ensure ongoing compliance. There were regular CNA huddles were held to review competency in recognizing sepsis signs and ensure effective preventive practices. Of course, there were challenges that were encountered. There were documentation delays. Nursing often delayed completing the EMR documentation until the end of the shift. Immediate reporting had been encouraged to address this barrier. And then communication concerns. There were challenges in getting physicians to accept the nurse recommendations. They also had the resident families. They were invited to participate in the oral care training, including feeding awareness to support infection prevention efforts. Mary, next slide. And on this slide, this is just the results of the work that was done. For the outcomes, the implementation, as you can see, it started in February 2023. And they had, I see that the left axis is missing, but this was 5 cases of sepsis, and then it increased up to 7 in May. And then as you see all the way from March, there was 0 cases of sepsis. And to this day, they continue having 0 cases of sepsis in their community. So they, through this implementation, they were able to reduce the sepsis and pneumonia cases. The nurses reported increasing increased confidence at recognizing and discussing sepsis symptoms. And there was a notable improvement in the oral hygiene practices among the staff, especially those residents with dementia. So, driven by a detailed root cause analysis, we led to significant improvements. We addressed training, procedural gaps, refining protocols, and enhancing staff competencies. The facility effectively improved their resident care, as indicated in this data slide. So, moving forward, the facility continues to focus on improving communication between their nursing staff and their physicians and maintaining vigilant monitoring to sustain these gains. And then next slide, please, Mary. Any questions on anything that we've learned today or that we shared today? Or open it up in the chat, or if you want to come off mute. We have about 4 minutes left in our half-hour Quick-N-R. All right. I don't see any other questions in the chat. I want to thank everybody for participating and joining us in today's session. Please take a few seconds to click on the link for the evaluation. We always love to hear from you as to what you would like to see coming up in our next or future sessions. Lastly, Mary did put a couple of things in the chat. There's a respiratory virus toolkit that's out there on CDC. It was just recently updated. Click on that link. There's a lot of good tools, resources, and ideas on respiratory illnesses in your community. And then lastly, there's a YouTube of a group. Let me pull my email real quick. Sorry, I apologize. It is Sepsis 2.0, SEPTRIS 2.0 is here. It's a simulated educational platform to teach providers to recognize and treat sepsis. And so if you go click on that YouTube, you can take a look at that. And I was kind of playing around with it a little bit this morning, and it's just part of their sepsis awareness. It was put out by Stanford Center for Continuing Medical Education. So take a look at that YouTube, another opportunity for education for your community and your team. All right. No other questions. I want to thank you all for your time. Appreciate it so much. And I'll give you 2 minutes back in your day. Enjoy the rest of your week, everyone. Aloha.
Thank you.